Prakhar Garg will be host for the session Career Talk with a Plastic Surgeon with Dr. Mahesh Mangal. Plastic surgery is a perfect blend of arts and science and requires perfect planning, imagination, and innovation to achieve the desired aesthetic and functional outcome. Plastic surgery is done to enhance one's self-appearance. The word plastic surgery originated from the Greek word plastikos, that means to mold. Aesthetic plastic surgery provides people with an opportunity to change or improve their personality or physical appearances through surgical techniques, making normal appearances of a person from average level to aesthetic level. Whereas reconstructive plastic surgery is a lifesaver for accident victims. We hear the news of some factory accidents every day in the news. Similarly, there are news of acid attacks too. The victims of such accidents many times feel in trauma and they feel they have no control over their life. Reconstructive plastic surgery helps these people to regain their lives. Now, if we talk about the beginning of plastic surgery, the first recorded procedure in the world history dates back to ancient India, wherein physicians in the ancient Indian used skin graft for reconstructive surgery as early as 800 BC. According to the global survey by International Society of Aesthetic Plastic Surgery in 2020, India ranks 9th with 6,43,752 cosmetic procedures conducted in 2019. Global market is even bigger, with over 2.4 crores procedures done in 2019. Modernization and changing lifestyle has transformed the thinking of people towards necessity of self-improvement, especially in the entertainment industry. And we can surely foresee huge demands of skilled surgeons in the coming future. To know more about cosmetics and plastic surgery, we have with us a very eminent speaker who is an expert on this topic, Dr. Mahesh Mangal. Dr. Mahesh Mangal is the chairman and head of Department of Plastic and Cosmetic Surgery at Sir Ganga Hospital, New Delhi. He has 39 years of experience and has performed over 25,000 plastic surgery in his career. He pioneered the use of microsurgery technology for reattaching cut body part back to the body. He, along with his team, performs approximately 400 aesthetic surgeries every year. Dr. Mahesh Mangal is a very experienced and highly trained plastic surgeon who has worked in India's top hospital in the last 2 decades. We welcome you, Dr. Mangal. It's an honor to have you here with us today. I would now request you to please share your thoughts on plastic and cosmetic surgery, how the career looks in plastic and cosmetic surgery. Over to you, sir.
Thank you, Mr. Prakhar, and good morning to all dear friends. Plastic surgery is very interesting branch nowadays because plastic surgery is so expanding in our country. We can't thought of when I have chosen it as a career almost 35 years ago. At that time, plastic surgery in India was very, very primitive. There are only very few plastic surgeons. Say like in Delhi, there are only maybe 8 to 10 plastic surgeons and there is very little work. But in last say 30-35 years, the plastic surgeons, the plastic surgery work, the technology, the quality, the experience, all has increased tremendously. And the special thing about plastic surgery is that it doesn't involve any organ basically. And as a plastic surgeon, all plastic surgeons, they work for poorest of the poor and the richest of the rich. That is a very interesting thing about the plastic surgery because we have to treat the poorest of the poor patients, maybe for accident victims, maybe for burn victims, or maybe for other birth defect basically. And for the richest of the rich, because they came for enhancement of their appearance, their look. There are a lot of people in entertainment industries, social industries, which take the opportunity of their enhancement by the plastic surgeons. So it's such a vast field nowadays that the plastic surgeons do a lot of work basically. And nowadays basically, this plastic surgery is so much vast that it has developed many subspecialties. Say aesthetic surgery is one subspecialty, hand surgery is another specialty because of so much of the cancer involvement in our country, especially the oral cancer, the breast cancer, the reconstruction of the cancer part, because the cancer surgeon remove the part, but the plastic surgeon, they reconstruct the part. Another is the congenital, basically, the craniofacial subject. There is a lot of cranial anomalies, facial anomalies. There are the birth defect. There is another subspecialties. So nowadays there is a lot of subspecialties which are fully grown in plastic surgery subspecialties. And another important thing is that now basically at our time, the people were going abroad to take a further training in plastic surgery. Now our plastic surgeons in India are doing so much of excellent work. They are so much trained. They are so that there is no need to go outside to take the further training, because we have so much of high volume centers which are doing different kind of plastic surgery in our country. So that is the thing nowadays, plastic surgery. I'll just give a little presentation about that, what plastic surgery is, that how plastic surgeons should be there, what career one can take as a plastic surgeon, and what is the future of plastic surgery. The plastic surgery is basically, if we see the literature, if we see the history of plastic surgery, it has been developed in India. 800 BC, our ancient, basically the physician, Mr. Susutra, who was doing a plastic surgery in 800 BC. Basically. It is all a documented in the Indian history of plastic, in the history of plastic surgery. Because at that time the punishment was to cut the nose. Basically, this punishment was given to the criminals, and at that time Mr. Susutra was making the noses by using the skin from the forehead. So that if we go through the history, the plastic surgery was originated from India. The plastic surgery basically, because when we were the students, we were taught that in plastic surgery some plastic has been used basically. Even if now today's world, there are some patients come that, Doctor, what kind of plastic basically used to enhance my image basically. That this plastico word is very misnomerous for a plastic surgeon, but it's a Greek word, and plastico means is to mold, because we use the tissues of the body to make or to reconstruct the part, so that the plastic surgery is to mold or to recreate the lost part of the body. So now why we are talking about this talk about plastic surgery? Because we know that in different specialties of medicine or a surgery, say like neurosurgery defines a surgery to the brain. Say like the gastrosurgery, it defines the surgery related to the abdominal organs basically. Say like orthopedic, it defines the problem with the bone basically. But the plastic surgery doesn't define any organ system of its own. So it's not related to any anatomical age or any anatomical area basically. So in public basically the plastic surgery is very poorly understood. Some people thought that the plastic surgery is only limited to the aesthetic surgery, only to improve, or only to the area of the burn basically. That the plastic surgeons do some skin grafting, but it is not like this basically. So plastic surgery is totally a technical base, and it is basically the plastic surgeons is like a surgeons of the surgeon, because the plastic surgery help to the surgeon, the plastic surgeons help to the surgeons, maybe a neurosurgeon, maybe an orthopedic surgeon, maybe a gynecologist. So it is a specialty which involves right from head to toe. So it is a very poorly understood branch in public music. Now, because nowadays the plastic surgery we define, mainly it is divided into two specialties. One is a reconstructive surgery and another is a cosmetic surgery or aesthetic surgery. A lot of things which a plastic surgeon in reconstructive surgery does. Maybe it is related to the birth defect, maybe it is related to the trauma, maybe it is related to the burns, maybe it is related to the cancer. But as far as the cosmetic surgery is concerned, nowadays cosmetic surgery is done from any body parts now the cosmetic surgery is possible, right from head, say right from hair transplantation to the rhinoplasty to the facelift to enhance the breast, to enhance the look of the abdomen or any other body parts. So basically nowadays, mainly there are two specialties which are very well developed in our country. Now, in reconstructive surgery, because every day we see there is a lot of trauma. Mainly it is a road traffic accidents or maybe a small home accidents or maybe industrial accident. Because if there is a cut, it can be a simple cut or it can be a complicated injury or there can be some fractures. So it all they are deal by plastic surgeons so that your body images, your scar, they are very much minimized and your function maybe is remain intact. Another very important part is replantation. Replantations mean to join the cut part because in our agricultural accidents, whenever there is a harvesting seasons, there is a lot of injuries in which the hand or the thumb has been amputated in industrial accident. Sometimes the hand is stuck to the any machine or maybe a paper cutting machine or maybe some other machines. So when we were maybe 35 years ago, there are very few centers or very few trained plastic surgeons who were able to reattach these parts because it's a very complicated surgery at that time. Nobody was trained. It's done by a microsurgery. This operations have been done by under microscope with magnifications. But nowadays, in last 30 years, I think there is a lot of centers, there are a lot of surgeons who are very well trained and are able to reattach these parts. One important thing that I want to tell that to a general public that how to basically preserve the part. If some accidents has been taken place at any place, the important thing that if we preserve the part properly, then it can be replanted better way. Because if we have not preserved the part survival time is less visible. So it's very important to know for a general public that if somewhere, someplace, if your finger, thumb, hand or any part is amputated, please keep that part in a clean polythene and take another big polythene, put some ice into a bigger polythene and hang that part into the inside of that bigger polythene. The idea is basically that the part temperature around the area should be around 4 degrees centigrade. And in that way, you can transport this amputated part to a center where these replantation facilities is available. This is just for knowledge to the public that how to preserve that part so that this part can be saved or for replantation. Another thing is every day we are seeing that because now the roads are better, the cars are better now, and because of the high speed, there is a very high speed accidents. And every day, particularly the two-wheelers, we see these kind of a patient issue. Because until unless we will not do a proper reconstruction, these patients cannot, we cannot save these limbs because these limbs when these facilities were not available, these limbs were amputated or maybe if they are saved, the patient is not able to, the limb is not able to work properly. The burn is very important, very severe problem in our country because there are a lot of things which are happening even nowadays that people are not taking due care. It's a poor country, So plastic surgeons, they treat the burns, particularly severe burns, is a life saving. So plastic surgeons take care of these cases. Now we will go to the birth defect. There is a lot of birth defect which basically are treated or reconstructed by plastic surgery. Next is you will see that we call it as a cleft lip. The baby is born with a defect in the upper lip. The upper lip is not properly formed basically. And sometimes along with the lip, the inside of the upper inside of the mouth, we see the palate, we call it as a palate, that is also not formed. This is a very common anomaly in our country if let's say 3,000 children are born, one child is born with this kind of a deformity. There is a lot of other facial deformities. Sometimes the ear is not properly formed, sometimes the nose is not clearly formed, sometimes there is a lot of hand anomalies, there is sometimes extra digit, sometimes the two digits are joined, and there is a lot of hand anomalies also, which has been treated by plastic surgeon, which has been corrected by plastic surgeons. So another important thing is that we call it as tissue expander, use of tissue expander in plastic surgery. Because whenever we do a skin grafting, the skin graft doesn't matches with the surrounding skin. So this expander technique has been developed, and a lot of plastic surgeons use this technique to replace the graft skin with the normal skin. We have seen that in this patient, the grafted skin has been replaced with the normal skin with the use of expander. Another thing which basically is like a miracle for a patient is that there's a lot of patients which loses the thumb basically, and without the thumb, the hand function is around 40%. So we reconstruct the thumb by taking the second toe of the foot. You can see that in this patient that the second toe of the foot has been taken along with all the structures, means the artery which supply the blood, the veins, the tendons, the nerve which move or which provide the sensation to the foot, and we reattach to the thumb, because there is a lot of similarity between the thumb and the toe, and it is used to reconstruct the loss of thumb so that the hand function can be maintained. Another important field for plastic surgeon is cancer. What cancer surgeon do is that his aim is to remove the cancer basically. When there is oral cancer or breast cancer or some other cancers in the skin or other parts of the body, then the cancer surgeon basically remove the part. The defect remain. And when that defect, sometimes particularly in the oral cancer, we remove the tongue, sometimes we remove the lower jaw and lot of upper jaw. So the plastic surgeon's job is to reconstruct that part. Suppose we want to reconstruct the bone, we take the bone from the leg. We want to reconstruct the skin, we take the skin from the forearm or from other parts of the body. Same thing basically for the cancer breast patient, because for a lady, if she is suffering from a breast cancer, if the one breast he has to lose his one breast, it's a very, very psychological effect on the lady. So we reconstruct the breast by taking the tissues from the body. So cancer is now a big field for a plastic surgeon. Now we'll talk about the aesthetic surgeries, because now there are a lot of people, basically media, all the things basically they talk about the aesthetic surgery, because it's very, very fascinating for all the people. Now the aesthetic surgery is so well developed nowadays. And the most common procedure in aesthetic surgery is, I think, still is rhinoplasty. Rhinoplasty means the correction of the nose. Because the people have maybe sometimes there is some problem in the nose, maybe the nose is too long or too short or depressed or a little bit deviated, or there's a lot of problem maybe by birth or maybe by trauma or something else. Basically. So this is a very big field of, now in plastic surgery, there are few plastic surgeons who are doing only the nose, and they are surviving. So in plastic surgery, you can see that how much is the scope basically. There are only plastic surgeons who are doing only the nose. There is no work with. Another thing is that the facelift, which just to improve because of the aging, the facial skin or the facial tissue, they start sagging, and they give a little look of aging face. So to improve, we do the plastic surgeons do the facelift. Now there is a lot of problem in the breast basically, because sometimes the breast is too heavy, maybe for unmarried girls or maybe for married. So the heavy breast basically give not only a cosmetic problem, but it's a physical problem. There is a lot of pain in the shoulder, there is a lot of skin problems and problem to wear the clothes. So these people, they demand for right size of the breast. So we do a breast reduction. And for breast augmentation, maybe it's a small breast, or the sometimes for after the baby feeding, the breast loses its tissues. So there is a lot of work in cases of breast surgery. So breast augmentation or enhancement of the breast usually done by implant. The implants are available, but there are few people who doesn't like implant, because implants sometimes have their own problem. So it can be done by fat grafting also. So we take the fat from the body and we inject it into the breast, and breast can be enhanced by the fat grafting. The breast problem is not only in the female, there are male viscera, but very young males, particularly what happened at the puberty. Sometimes what happened is that in male puberty, what happened is that when there is secondary sexual characters develop, then sometimes in few cases the male breasts develop too large basically. We call it as a gynecomastia. The enlargement of the male breast is a gynecomastia. And nowadays, because of the consciousness or because of the change in socioeconomic structure, there are more and more patients. There are number of patients have been increased basically. And particularly at the age of 14 years, 15 years, 16 years of the age, whenever the child basically feel that his breast size is bigger than the normal size, they feel very much embarrassed basically, because they can't wear the tight clothes. They feel embarrassed while swimming or some other sports or in gym basically. So it gives lot of psychological problems to the children, and very difficult to understand the parent basically. When they tell this problem to the parents, then they don't understand it, what my son is talking about. But it's a real problem basically. So the plastic surgeons correct this problem. Now, lot of because of pregnancy or because of the weight loss, whenever there is a abdomen is lax or it becomes loose, then has been corrected by plastic surgeons. They do a liposuction with tightening of the abdomen. The fat is in aesthetic surgery. Fat has been very much used. We take the fat from the body, say from the abdomen or from the thigh, and can inject it into any place of the body, maybe in the face or maybe any other part of the body. Fat is your own tissue. It takes very well. It doesn't cause any problem in the future. So wherever if some enhancement is needed on the body, fat is a very good donor. So plastic surgeons use lot of fat grafting. Now another field which has been like an industry is hair transplant. For last I think 10-15 years, it's a big industry which has been developed in India. This industry was not very developed or very popular, or experts were not there say 15 years back. But nowadays it's a full-grown industry. There are a lot of people who are only doing a hair transplant. There are a lot of plastic surgeons who are doing only a hair transplant. There is nothing else. So there is a lot of scope for hair transplant. Another thing is that the non-surgical techniques of aesthetic surgeries, you must have heard of Botox or fillers or lasers, because these are used in aesthetic non-surgical. These are the non-surgical technique, because the Botox is used to remove or to just the lines which are basically because of the aging. Fillers, where there is some depression, the fillers are used. Lasers are used to enhance your look or to remove the scars, etc., etc. There are other fields which are coming up in plastic surgeries, that there is a lot of patients which are demanding for their sex organ rejuvenation, maybe a male patient or a female patient. Nowadays, there is this sex reassignment surgery, means sex change surgery. There are a lot of patients which are demanding for a sex change surgery. maybe from male to female or female to male. Now, what is the future of plastic surgery? I think the future of plastic surgery, I think, in my view, is I'm very much satisfied with my specialty, with my work, because it's a vast specialty. We work from head to toe. We help all other surgeons. So we are surgeon basically. Plastic surgeons is a surgeon because we help the neurosurgeons, to the gynae, to the orthopedic, to the neuro, every specialty of surgery needed plastic surgeons help. In this specialty, the learning curve will be more, and the person has to understand the concept basically. Because there are few concepts of plastic surgery which everybody has to follow for their practice. Now the plastic surgeon basically, what it need to be a plastic surgeon, that quality a plastic surgeon must have, because if the plastic surgeon doesn't have those qualities, he will not be a good or successful plastic surgeon. It's a very hard-working job. Sometimes we have to work for even 12 hours or maybe more than that, because there are certain operations in plastic surgery which takes 10 to 12 hours or sometimes maybe more. So it require a detailed anatomy, because we are working on the skin or under the skin or to the bone. So you do a detailed anatomical depth is needed. Our plastic surgeon's mind must be artistic, because there is no definite procedure or definite technique basically. Because there are certain definite technique, but according to the patient's need or according to the situation, you require to mold. That is why we call it as a plastic community. You have to mold or you have to use the tissues so in a better way, so that it give a best result to the patient. It requires your good vision, which your eyes must be perfect, because we are working on a very small on the tissues or vessels or nerves. The plastic surgeon must have a lot of patience, and must be very precise. And plastic surgeons, certain work which need a teamwork, because alone a plastic surgeon is a very, very difficult operations, very lengthy operations, very difficult to do. It need a team basically. So one must be able to do work under a team. Now, basically, if somebody think that why I want to be a plastic surgeon, I want to be a neurosurgeon or a cardiac surgeon, but I'll say that it's very interesting, very challenging branch. It's very challenging. I just give an example. When I do my first replantation around 30 years back, when a patient come with a chopped thumb basically. I've never done a replantation before that. I just saw with my boss that he was doing it. But when I do my first replantation, I think that was and it was successful. That was the biggest. Well, I was so happy with the results. So this plastic surgery is so basically satisfying branch. I don't think that any profession or any surgical branch must be satisfied as a plastic surgery. So every procedure is unique basically. You have a different procedure, because every patient is different, because maybe a problem is say like a breast cancer, but every breast cancer patients require a different thing basically. Oral cancer, they're different. Well, every procedure is different, and you can improve your results by improving yourself. And we all know that we treat all good patients. Or all types of patients from the economic backgrounds or from age and sex. It's not like that the gynecologists are dealing with the female patient only. We treat all sex, all age, all economic criteria. Now, basically, if somebody wants to is interested in taking the field of plastic surgery, then how he has to go about? Say after doing a +2, then he has to take an admission into an MBBS course. And after doing an MBBS, he must pass the NEET examination. For plastic surgery, there is a after MBBS, he can directly go to the 6 years DNB program. This DNB program, there are two programs which are run by the government of India. One is done by the MCI, which has been done mostly in government hospitals or big private hospitals. Then another program, basically the academic program, which is degree program, which is run by the Health Ministry Government of India, is a DNB program, Diplomate National Board. They also provide degree, maybe MS, MD, or super specialty like DM, MCH. And the degrees are the degrees, the DNB degree or say MS and MCS degrees are the same basically. So for plastic surgery, one MBBS student can go directly into the 6 years program. Or another is that he has to first pass MS in general surgery, ENT and orthopedic, then he can choose a plastic surgery, then he has to again appear for the NEET and can choose the plastic surgery or DNB plastic surgery or MCS plastic surgery. So after MBBS, anyway he has to spend 6 years to be a plastic surgeon. So once the person has completed, taken a degree, then I think, in my opinion, he has to take 1 year skillful work at a high volume center, because he has to understand a little bit. He has to have a close working in a degree program, because he has to do a lot of work, the academic work, the other work. So he is not very closely, basically. Now he is not done. Most of the work he has not done himself, basically. So to improve his skill or to better understand the subject, he must take 1 year skillful work at a high volume center. A lot of high volume centers are available in India, and he has to work there to improve his skill. And he can either choose the subspecialty or he can work as a general plastic surgeon. So to work, basically, either he can work in a government hospital, because there are a lot of government hospitals nowadays. There are a lot of institutes which have plastic surgery department, and most of the medical colleges now in capitals or have very good, well-developed plastic surgery department. He can take government job, or he can come into a practice, maybe an individual practice or practice in a big hospitals, basically. The important thing, the good thing about plastic surgery is that he can work even at a smaller places, say like a district place or maybe a little or sub-district place, because there is a lot of work there. Because the trauma is there, the aesthetic surgery is there. Maybe money may be less, but as far as the patients are concerned, there is a lot of patients, even at a smaller places. He can have his own practice there and can do a better job in even in a smaller places. One thing which I want to tell you that the transplantation, is now a big thing which is challenging, and which there are two things basically: regenerative medicine and transplantation, which can change the face of plastic surgery. If you see the Indian mythology, this is the biggest example of transplantation. Even now today, nobody is able to do a head transplant in modern science, basically. But if you see our mythology, because the Ganesha, the head has been beheaded by Shivji, and when he realized his mistake, he put the elephant head on his. Then this is the biggest example that at that time, that how developed by our science at that time. So now the transplantation, routinely you must have heard about liver transplant, kidney transplant, heart transplant, or even the lung transplant. But as far as the plastic surgeon's perspective is that nowadays, even in India, basically the hand transplant has been done, because there is a lot of people which lose both the hands. Very difficult to survive or to maintain their life. For these patients, they really require hand transplant, because the artificial hands are available, but artificial hands have their own limitations. But hand transplant is the alternate, is a better alternate for those people, and it is now available in India. And the Amrita Institute in Kochi has done many hand transplants. other hand transplant, the penile transplant or a face transplant. It has not been done in India, but this transplant has been done worldwide. So now, in transplantation, you never know in the future, basically, or in regenerative medicines, because there are a lot of people who are doing a lot of work on regenerative medicines to develop the body structures in the lab. Maybe if your nose is cut, if somebody will take your stem cells and will develop the nose in the lab and will put it back. So the future is basically it's very difficult to say, but it's a very bright future for these things. This is the transplant, and on the left side is a face transplant, and on the right side transplant. So I can assure you that the future of plastic surgery is very bright, because as long as there are congenital organ abnormalities, because people will need children's help. As long as there is trauma and burns, because you take the help of plastic surgery. As long as there is a cancer, always there is a need. As long as there is infections, always there is a need. As long as the human mind craves for beauty, always need an aesthetic surgeons. So there is a great scope for plastic surgery, all its subfields.
Thank you, sir. Thank you. That was indeed a very detailed and very, very knowledgeable session. And to be fair, I had a lot of questions before the talk about the plastic surgery, and I guess most of my answers, the questions are already answered. So, sir, you've been a plastic surgeon for so many years. So, right now, what do you see? Like, how do you see your day? Like, what's your day in day out job? Is it like you start your day and have like 3 surgeries, 4 surgeries every day, or how many patients do you see every day, or these kind of things? What it is like, or maybe do you get a lot of call-ins for immediate surgeries or something?
Basically, because I am working in an institution, I have a team. I have a team with we are working we are 5 plastic surgeons. We are working together. I am heading the unit and the department. So I have developed my team so well, because until unless you want to work in a plastic surgery, you have to develop a team. Basically, if you want to do all kinds of work, you have to develop a team. Basically. So I have developed a team. Because in my team, there are certain people who are more experts in the hand. There are certain people who are more expert in the aesthetic surgery. There are certain persons who are more experts in the cancer reconstruction, because you have to develop a team with you. So our teamwork is there with you. And we see, as a team, we see right from morning, basically, we have some OPDs every day, we have some OTs every day, and we have some emergency work. In emergency, basically, we do a lot of things which I have shown to you. Maybe the facial injuries, maybe hand injuries, maybe burns, basically. And routine operations which we do is the same, basically. Maybe some birth defect, maybe some post-trauma patients which have been not fully recovered. Some cancer patients, we work with the cancer surgeon to reconstruct the oral cancer or the breast cancer. So we are, or another thing, because we have a teaching program, we have a DNB program in plastic surgery in our department, because our students basically comes after MBBS, and we have a 6 years course. Our students remain for 6 years with us. So we train them, we teach them. So this is our basically routine, that right from morning we do some OPD, we do the ward round, we see the indoor patients, and then we do if we have an OT, because maybe some surgeon in the OT, some surgeon in the OPD, and we have a academic teaching program to teach the students.
Thank you, sir. Thank you. That was a very hectic day, I feel, to be fair, but a well-planned day as well at the same point of time. So once you have things planned and organized with your team, obviously it is more easy to take care of all the activities that you have in hand. So I definitely take that very kind of a knowledgeable side output as well from this particular answer. One more question, sir, I was having is when you're mentioning about that one can practice individually as well, or as a team in a hospital or government or private hospital. So what kind of facilities are available? Are there enough facilities available in India for outreach to say suburban areas or maybe some rural areas as well?
The plastic surgery is vast, basically. Because if you say I'm working in a city like Delhi, in a hospital like Ganga because we have all top facilities. But suppose you are working in some remote area or some sub district or some tehsil or something like that. Then you have to limit your basically. You must know that what kind of a surgery you can do there because you are alone. You can't do a surgeries which are very big because you need some machines. Because, say like if you want to do a reattachment or replantation of some part, then you need either a loop or a microscope. Basically. It either he has to purchase because he has a lot of people who are doing it. And other instruments are not very expensive, which are basic instruments. They are not very expensive. Basically. Now everything is available in India. They are not very expensive. So there are a lot of people who are young plastic surgeons who are sitting in a smaller place and they are doing a very excellent work for the local people. Only thing that problem is sometimes happening that they are not getting too much money basically because their people are poor people. They don't want to move from this place. They have very limited money basically. But if you want, if a plastic surgeon wants, then he can do. I think I can assure you that 80% of the plastic surgeon's work can be done at a remote place with a very limited infrastructure.
Thank you, sir. Thank you. So it is mostly like related the availability of resources at that particular location, and you have to kind of adjust to that and mold yourself accordingly. So while molding the skins and molding the appearances of everyone, you are molding your own way of working as well in there. Thank you, sir, for that answer. So you're talking about a lot of specialization in plastic surgery for reimplantation and amputation and everything. So how should student decide which particular specialization is good for them?
Basically, it depends upon because once you do a basic degree course in plastic surgery, because in basic degree course, everything he has to see all everything. He has to read all the things. Then he develops some interest basically. So when I completed my degree course in plastic surgery, then I developed some interest because in Ganga hospital we have a microsurgical lab basically. At that time, so our boss was doing a say microsurgical anastomosis, means there was a rats in the lab, so we open the rat and we take out the blood vessels of the rats and we divide them and then re-anastomose it under the microscope because the size of the vessel is maybe a little less than 1 millimeter size. So it is very difficult to do with the naked eye. So we use the microscope with the magnification maybe 6 times or 8 times. So with that, under the guidance of my boss, Dr. Gupta, I basically learned this technique. I practiced this technique and I developed this interest. So it is basically when you do a degree course, then sometimes some people basically develop some interest. Either you want to do an aesthetic surgery or you want to do a reconstructive surgery. And suppose in the say hand or onco reconstruction, it take I think some time to take these specialties. But say two broad specialties, reconstructive and aesthetic. Some people decide at a early stage basically after doing a degree. But some people basically because if you want to be specialized to a particular, say somebody wants to do an aesthetic surgery, then it's very difficult to start because he doesn't have so much of experience in aesthetic surgery. He has just passed maybe 1 year post degree basically. He does not have that much of experience. He does not have that much of money to establish his own center. Either he has to work in a group or a team where the aesthetic surgeons, there are 2 aesthetic surgeons are working with you. Because to develop an individual practice from starting is very difficult because you doesn't have that much of experience, you does not have that much of expertise, you don't have money basically. So for that thing basically, to develop an individual practice is very difficult for a newcomer. But maybe after a few years basically he develops some practice, he has some followers, he has some references, then he can have his own area of interest, whatever is maybe aesthetic or maybe a reconstructive. It's basically his own your mindset because in reconstructive there is a lot of hard work. In aesthetic, you don't have to wake up in the night basically because it's a planned surgery. It's a very planned surgery. You can plan that I'll do this surgery at 10 o'clock. But in a reconstructive surgery, suppose say some cut hand come at us say in the middle of the night, then you have to rush for that. So you have to decide that what your nature, your mindset, your working is, whether you want to go to the reconstructive or an aesthetic surgery. Because aesthetic surgery initially has very lucrative money. You don't have you earn money without doing it too much hard work. But in reconstructive surgery, it's very satisfying. Less money, more work. It's all depend upon your personality, your mindset, your what you want to do basically after doing a basic degree.
Thank you, sir. Thank you. That actually answered one more question of mine, wherein I was thinking what kind of challenges and pressures are there. But just like you mentioned, different career of different specialization offer different kind of challenges. And sir, obviously, I've already mentioned how satisfying the job is. So, in terms of monetary, sir, so one last question I was having is because that is one of the main point of getting into a job, getting into a specific field is to have monetary benefits. So, how well is plastic cosmetic surgery paid compared to other surgeons?
I think there is a lot of money basically. Not only I can even a doctor basically even an MBBS doctor earn a lot of money basically. So as far as the monetary benefits are concerned, whether you are working individually or in a corporate or in a, but basically in a medical profession, money comes little late. If the money should not run, you should not run behind the money. Money should run behind you. Basically. This is my concept. If you are good, if you are hardworking, you know job, you are honest basically, because the people like you basically, and they will be behind you. They can spend any amount of money for you. So I don't think that there is a problem in the money. Problem is in the doctor's mind basically. If you are honest, you are hardworking, you are not behind the money. Money will run behind you one day. It takes time to earn money, but maybe in the initial stage, people have enough money to earn, to run, to feed their families, to have. It's not there is no problem of the money. I don't think that there is no problem. People have a lot of money basically in this profession, especially in aesthetic surgery. People are minting money like anything else.
Thank you, sir. Thank you. That was indeed very, very knowledgeable and very helpful. So we would like to thank you, sir, for such an engaging and insightful talk. I would like to close this session here. I'm sure the talk would help our young minds out there to start their new prosperous careers in cosmetic and plastic surgery. To our viewers, I would like to say that while many years of school and hard work is required to become a plastic surgeon, the rewards can be very well paid job, continuous in demand and skills, and that is a very good work environment as well. So with this, I would like to conclude this session, and I would like to thank you, our guest, Dr. Mahesh Mangal, as well. So thank you, sir. Thank you for being here.
Thank you, Prakhar, and thank you, TCS, for inviting me for such a wonderful talk. Thank you.